Hey, what's going on? Tyler, you're on mute.
Are you in Arizona or California?
No, I'm in Arizona right now. Yeah,
Arizona.
yeah,
Nice.
yeah. What you got going on tonight?
I'm gonna watch some of the Stanley Cup and learn more about how to become a diplomate.
Well, we're gonna go over that. This is gonna be great.
I'm still waiting to get my associate fellow results. I guess that's in July. The oral exams, I guess
Yeah, yeah.
yeah.
That you haven't heard yet?
No.
Man, I don't know when they. I know that I just got the pass fails for this year's diplomat today, so they're probably on that. They're probably on that. They're probably on that same time frame.
Yeah.
So
I think the most questions I have are about like the cases that with the photography and like if there's like a sheet that I can kind of track the cases and make sure um I have proper documentation, it sounds like.
right. You know what? Let me see here.
I know I got to get back to Pathway. I have a 1 year old, so I know Bruna's like,
Well,
come
listen,
on. Come on.
I get that. That's not always the easiest
Yeah.
to do. So I thought I had a. Let's see here. Calibration meeting.
Hey, is it just the five of us?
No, I think I got to let some more people in here. Hold on. Oh
All
shit,
right.
we got all sorts of them in here.
I'm going to turn off my camera and whatnot and my audio if that's okay, unless you got something cooking there, Dr. Moody.
No, no,
Can we still call you Justin now that you're a muckety muck or no?
no. You should only call me that. It's all good.
Uh, all right. If you say so, it's like letting the cat out of the bag now.
Yeah.
Everybody's going to be too familiar. You're going to have to lower the boom on someone at some point. What do we do?
Yeah. All is
All
good. Let me.
right. How many practices do you own right now? The one in South Dakota, is that it?
I got one left in. I got one left in my hometown. The mothership of my private practice is the only one I got left. Uh,
Wow. Thank God. Scrape off the dead weight. Start living a good life. It's too
yeah.
much work, man.
I don't ever have to go there. I've got a long-term associate, and I must pay her too well or something because she doesn't want to buy the damn thing.
Well, that's a good position to be in.
Yeah, yeah, I suppose. She does such a good job, and like she should just uh,
Buy it.
yes, but she's not. Examiner
Not
schedule.
everyone's ready to buy.
What's that?
Some people just don't want to own, man. I don't
Yeah, I
understand it.
know. I know it. And that's okay. That's all right. All right, let me. It's fine. I
All
think
right,
it's
I'm going to mute myself. You do your thing there, Doc Mooney.
yeah. All right. I think we'll get started. I was looking for. There it is. Hang on. Okay. Well, let's get started here. All right. We've always had a ton of questions about, how to become a diplomate. And since I'm currently the president of this ABOI thing, I thought maybe I should probably know how to do this. So, I'd love for, everyone to, uh, become one. So I thought we'd just put this in there as this is what we officially talk about on at meetings and so forth, and at the AID meeting. So I'm gonna give you a bunch of information on it, and then we can just talk about it. So let's see. I got a slideshow this sucker. Hang tight. Slideshow. Beginning. Can you guys see my screen? How to prepare for the application?
No.
Oh shit. Okay. How about this? How about
I highlight.
There you go. That looks good.
how about now?
Looks good.
All right. And now let me try the slideshow. Now can everybody see the how to prepare for this application? Yep. Okay. All right. So the current cycle is for 2026. So this will be these are all relevant dates. And the application, we have two parts. We have a part one, which is a written exam. The only people that are exempt from the written exam are US and Canadian specialists and those that are already a fellow within the AAID. Then we have a part two, which is the oral exam. Things that were new for 2025 is you do have to pass part one, which is the written, before applying for part two. So you can no longer take both exams within the same year. And application deadline will be December 1st for the written, and you'll need to have if you're eligible for the oral exam and have already taken the written, you'll need to have it in by the 15th of January with your cases. There is one application for both, and it is possible, it's obviously possible to retake it if you had a misstep along the way. I don't know of any pathway grad or anybody that I've helped mentor not to get through this. So I hope to keep that streak intact. We got somebody to admit. There we go. Got a couple different routes. I think most everybody on this route will go through route one, which is through the general dentist route. We could have somebody that's an international dentist, and it's possible to have a specialist. So route one through the general dentist, you got to be a DDS or a DMD. Proof of 670 continuing education hours. And so these hours, these hours should be an implant education. If it says anything about implants or has any kind of clinical relevancy to implant dentistry, this isn't something that gets a full-blown audit. There's somewhat of a honor system to this, but at the end of the day, I think you have to, show proof of the actual certificate. So 670 hours. If you've completed any of these programs, you can get some hour credit. So if you did a GPR, that's good for 100 hours. If you did any kind of fellowship, 1 year is 100 hours, 2 years, 200 hours. If you did a 2 year GPR, it's 200 hours. If you are an AAID associate fellow, you can get the 100 hours as well. It's a 100 hour bonus. Plus, if you'd gone up through a maxi course and had the 300 hours, like that's in addition to. So if you did a maxi course and got the associate fellow, you'd get it a bonus 100 hours. So I see Tyler shaking his head like that's. I think this is a great avenue. And if you're an associate fellow, you get a 200-hour bonus, and you actually happen to be exempt from the ABOI written exam. Now, if you have a question along the way, like just unmute yourself and ask it so that we can stop. This isn't anything that is listen only. So route two is for international dentists. It's not much. It's really not much different. You still need the 670 hours. You'll still get the same credits. You just have to approve those things. And then obviously, if you're an ABO, if you're a specialist, you're exempt from the written version. So part one of the written exam is administered at a testing center. Is administered at a testing center, the Pearson VUE testing centers, and the exam is on Wednesday, April 15th. So when the sign up is active, and we usually open this up midsummer. When it's active, you'll pick a date and you'll pick a location, a Pearson location near you to go to. It's 200 questions, and they're 200 multiple choice questions. You have 5 hours to complete it. I don't really think anyone has had that much issue with finishing it up in a 5 hour time frame. When you arrive at the testing center, you'll need 2 valid forms of ID. This is harder than voting in the United States. So this is some pretty technical shit. Okay. You won't be allowed any electronic devices, anything like that. Don't bring a backpack or anything like that. Just show up with 2 forms of ID and get after it.
Moody,
Yes.
your slideshow is not following along on your screen.
What? Really?
At least not on mine. It's just the how to prepare slide.
Is everyone else at the same spot?
Yeah.
Well,
Yeah.
Yeah, I think your slideshow may be on like your second monitor, maybe.
I actually have 4 at my house. All right, God damn it. Hold on.
Now it says part 2 oral exam.
Yeah, if you just click on the slide on the left and then just use the down arrow, that might work.
Yeah, is that all right if you guys just look at this?
Yeah.
Yeah.
Yeah,
Okay.
fine.
That works.
All right. So I was actually just reading through these. So okay, come on. Those are the routes. 670. You get here is your hour credits for the approved programs, fellowships, GPRs. The GPR we also count. We will count an AEGD if you did an AEGD. So for every year that you're in a program like that, you get 100 hours. International docs, virtually the same thing. We talked about the part one. Like I said, the part one exam we do at the Pearson VUE testing centers. It'll be next April, Wednesday, the 15th. And you'll sign up for a time on that day and location. 200 multiple choice answers. Don't bring anything. Now we're caught up. The oral exam next year will be April 30th through May 2nd. And I believe it will be in Scottsdale again next year. I won't be the president next year. The president has some say in it, but it went really well here, so there's a good chance that it'll be here in Scottsdale. But The Part 2 oral exam consists of two components, the standardized cases. You'll have a section on implant surgery and a section on complications, medical assessment, and prosthetics. And then it'll be the candidates' submitted cases. These five, it's set up in 5 stations. Each candidate will be at a station for 30 minutes. There's 2 examiners at each one of the stations, and within each station, we'll present you with 2 different case scenarios, and you'll get a grade on those 2 different cases. So, implant surgery, will show you one case, and then we'll show you a second case. We'll grade you on your answers on both. And through those 4, then we will grade on the 5th station. We'll grade you on your own cases. So, and we'll go over the cases here in a minute. We will pick 2 of your cases, and it'll be standard. So, if we choose, it won't everyone. If we choose like a lateral window sinus augmentation and an overdenture, everyone would have the same ones. We don't pick within. We don't look at all your cases and pick and choose and say, oh, that one, maybe we need to ask them about that. It's standardized for the actual case itself. And they're all blinded, so the examiners, we don't know any of your identities. You will be given a candidate number, and that's it. Unfortunately, those of you on this call that take this exam, I will most likely have to recuse myself from examining you. But that's pretty irrelevant. Now, the cases that you need, case 1 is an edentulous mandible or maxilla with a full arch removable implant overdenture, utilizing a minimum of 2 implants for this. Now, what I will tell you is, if you brought us a maxilla and you only did 2 implants, like, you're probably going to get grilled a little bit on the standard of care for the maxilla. If you bring us a long time edentulous mandible that's thin and only has 2 in the front, that does meet the requirement. If I was to advise anyone on this, I would bring a 4 implant overdenture case, whether it's mandible or maxilla. But that's what I would do. Case number 2 is an edentulous posterior maxilla with pneumatized sinuses requiring a lateral window sinus augmentation, the placement of 2 implants, and its restorations. So that case will it'll be a lateral window. You got to drop 2 implants in that sinus. So some people make the mistake of turning in a single tooth, like missing a molar, and doing a lateral window in that spot. You got to put 2 implants in this site. So, and I think my best advice for all of you in these cases is, what I have seen people get in trouble with is they want to try to impress us with some ridge split, vertical, horizontal GVR with pixie dust and like all this shit. Like, I would tell you that I would bring cases. If I was doing a lateral window, I would bring a completely pneumaticized sinus with no pathology, good health history, and make it as easy and as simple as possible. Because if you try to bring a complex case, you'll get complex questions. You'll get complex scenarios of what could go wrong. If you bring an easy case, we may drag you down that hole to find out where your knowledge stops, but it'll be far easier on you, and it'll make you look better as you had a good case selection. Case 3 is an anterior maxilla with 1 or more root forms and its final restoration. This could be a single unit. Really, it's a single unit in the aesthetic zone. Case 4 is an immediate implant with extraction, or extraction and grafting with delayed implant placement. So if you don't do immediate implants, you need to bring us a case where you have taken a tooth out, grafted the site, let it heal, come back and place the implant, and then the final restoration. Case 5, edentulous mandible or maxilla with 4 or more that is fixed, screw retained. Case, it doesn't have to be a dual arch. Like you can bring a dual arch, upper and lower, but it only needs to be 1 arch with at least 4 implants. Case 6 is an edentulous posterior mandible or maxilla with 2 or more root forms in its restoration. So it's really a posterior restorations. Case 7, edentulous area missing more than 2 teeth, deficient ridge, we're requiring GBR. So this is your GBR case. It could be maxilla or mandible. And then case number 8 is a potluck. Like you choose your case you choose a perfect case. If it's another overdenture, pick the other overdenture. If it's another lateral window, pick another lateral window. The only thing it can't be is a single tooth restoration. It can't just be a drop dead simple single tooth restoration. You want to put 2 next to each other? Be my guess. Just this one, that's the only criteria for it not to be. The case reports, it's going to ask you a number of things, and the narratives. Be clear and concise with little extraneous information. Like, just give us the bare minimum. Don't go on a tangent and tell us about the case and so forth. Just give us the facts. Don't put the patient's names on these. If you do, just black out the names. Like we're not interested in names. Blackout. And this happens every year as well. Like it's supposed to be anonymous, and then someone turns in their consent forms and their health history forms and their practice logo and their name and everything is on the form. So try to black those things out to maintain your being anonymous. Radiographs and photographs got to be labeled with a date so that we know when they were done and that they correspond to your chart notes. If you've got a CT version, we want to submit. You want to submit it in the panoramic view, and then any supporting slices. So like if you put the implant in, I want to see it in the pano view, and then I want to see it in the slice. I want to see how the implant looks within the bone itself. As you know, CT are not actually required. Like panos and PAs are okay. You may get a question about why wouldn't you have a CT scan? But it is not actually required. The information required for each case, the modality, the date of surgery, pre-implant grafting, if any, insertion date of the prosthesis, number of implants, type of implants, opposing dentition. We want the current status, medical history, dental history, social history, treatment plans, implant surgery, basically the chart notes, post-operative care, what your maintenance appointments are, prosthetic restorations, and any radiographs along the way. So I would also tell you as you're working on this, if you find a patient, and this is like rules, right? Like I've got a perfect patient, but they got no money. I got a patient that has money, allows me to take photos and stuff, but like, man, it's got a cloudy sinus or it's got a thin ridge or like whatever those are. Like, I would tell you, if you've got a perfect case, make a deal with them. Like figure out how to do the case, document it the way you want it, and turn it in so it's ideal. Ideal stuff gets you through these exams, much quicker. The required radiographs, we do want pre-treatment radiographs, pre-surgical imagery. We've had that mandatory since 2023. Like we do need clinical photos, pre-surgical, post-surgical images, radiographs and photos, post-prosthetic. It's It's great if you include during surgery pictures, like when we talk about pre-treatment radiographs, maybe you've just got a retracted cheek, you got an occlusal film. We're not like we're gonna get more specific over time, but these are the bare minimums that we have. Uh, if you're really confident and you like you like the way it turned out and you have images along the way, put them in there. Uh, I just caution you, like if you insert any information or any picture or any X-ray that might not be ideal or you wouldn't want to talk about that image, I wouldn't put it in there. Just note to the note to the wise. Radiographs again, images of final restoration in function for a minimum of 1 year. So that is the requirement for us, is that the prosthetic has been in function for 1 year. That's come down from years past. When I took this exam, they had to be in function for 3 years. So it took a while. It took a while to get the cases, and I don't know about you guys, but like I swear to God, when I don't take photos of a case, it's when it turns out perfect. And when I take all the photos and stuff, you're like, God, I don't know if that's really what what I want to show. But just keep that in mind. The clinical photos we ask, occlusal view, maxillary mandible, frontal view in MIP, left side, right side, MIP. Cases involving implant supported, retained, or removables, occlusal views of the implant attachment mechanisms, view of the tissue surface areas of the removable prosthesis, the intaglio surface. Be prepared to talk about the design of the intaglio surface of your larger restorations. And this submission, the application process for both the application process for both the written and the oral is by December 1 of this year, 2025, and you have till the 15th of January to submit the oral exam cases. We use WeTransfer. We email it to applications at ABOI. We are currently working on a brand new web page with a case submission portal and actual templates for you to fill out. I do not know for sure if this new portal will be done by the time all of you apply for this. If you're in this cycle for the written or for the oral exam, so the web page has the actual templates to use, and you can download them. There's an application fee of $600, and then each part that you take has a testing fee in it as well. To submit your cases, this is the QR code. It gives you the PowerPoint template for the download. It's also available on the web page. Don't change anything in the template. Just leave it, as is, and add, add to it as need be. What I do highly recommend all of you do is the board review course. And this is given almost actually an entire month before the written exam. So remember, the written exam is April 15th of 2026. The board review course is it's virtual, and it's March 12 through 15. So this is the holy grail for the written exam. It is a long 4 days of listening, and the review course currently is being taught by past presidents or board members of the ABOI, Dr. Bart Silverman, Leonetti, who are both oral surgeons, Jack Peramati, and Alvaro Garcia, who are prosthodontists, and then Suhil Boutros, who's a periodontist. The five of them tag team this, and I will tell you that even if you didn't like, we have about 10 to 15 existing diplomats take this every year as just a review for their own sake. This course is extensive and it is thorough. It's going to go from medical histories through drugs through EKGs. It's going to talk about prosthetic designs, implant positions, CBCT, reading, pathology. Really, it's a culmination. So when I tell people, like, what are your study guides for the oral and the written exam? I think that you could read any of the textbooks out there. You could read Modern Implant Dentistry, with Silverman and Myron. You could read, you could read Mish's. Just remember that, like, Mish's book, is approaching 10 years old, and there's not a lot of as much fixed work in there as in the way we do it today, and there's really nothing digital in that. So I would highly recommend you take this course. It is really, it's just it's the thing to do for this test. If you have questions, our executive director and our only employee is Jenna Tucker, in Chicago, in Chicago. And that's her address. That's her email. That's the phone that rings there. Anyone have any questions? I with the limited time, or the time here, I thought that I would get this out there. We'll post this to those of you that are members of the Pathway Study Club. This video, the copy of this webinar will be on there. Anyone else that wants a copy of this, I'll send it to you. Just email it to me and I'll send it to you. We'll do another one later on. What I'd like to do in the coming weeks, if everyone would if everyone wanted to, I'll put together a case in the template, and I would go through, like, these are the pictures that we're looking for. These are not. How do you fill out the template? This is what we're looking for. This is what we're looking for as far as documentation, health history, chart notes, final prosthetics, and things like that. The example I was going to show you tonight actually has some candidate information on it. So but I think that I'll just open up and create one for you, and if that would be helpful for if that would be helpful for you guys, I'll certainly do that, and we'll set aside another time to just go over that, and then we'll actually we'll actually post that as well to the study club, and we'll make it available for everyone else to see. So anyone have any questions about what we went over? I know there's a few of you that were late to the show, and just email me or text me, and once I get this recorded, we'll upload it, or I'll send you a link to it, and you can view it and get caught back up. Any questions, comments, concerns? Let's see. I got a couple messages here. Let's see. Most complex, I could just send a pathway course to it would be nice. It would be nice if a person, if I could just do a course to like teach, to this. I do know that, the documentation is the worst. Like, for me, I swear to God, like I said, it's difficult to take the pictures, and every time I take it slows you down. So I would say get in a habit of understanding the pictures that you need to take, and maybe even get your team to take those pictures. Yeah, let's see, Nick. Yeah, the study material, like take the board review course. Like it's the foundational information for implant dentistry. I think Bart Silverman's Rick Myron's textbook would be good. I think the information is all in there, as well. But we certainly do that. So, well, I got you guys on here. We got a session. We got a session 2 in Chicago coming up 17th to the 19th of July. But Pathway alumni, uh, we've got a limited number of tickets, but we rented the entire rooftop bar at the Cubs game on the 19th in Chicago. So anybody that wants to come to Chicago Saturday night and hang out with us and watch the Cubs game, I think alumni is like $50, and I think you can bring a spouse or a guest for $100. And it's all the hot dogs and food and beer that you can eat or drink, and it's on the rooftop across the way. So it'll be good fun. Just wanted to let you guys know, like I think he's got 100 tickets for it, so it's kind of first come first serve. But if you want to come out to Chicago and catch Cubs game with us, man, we'd love to have you.
Hey, Justin, I have a question.
Yes, sir.
When you say they have to be in service for a year, so is that from the date, like the sign up for the exam, or like say I do a sinus tomorrow, I put 2 implants in it, and then I don't put crowns on it until whatever, I wait 6 months. When are we starting is it the pros has to be in function for a year, or you had to like from the date of the implant? What's the timeline?
Post prosthetic and seating. So
Okay.
if you seated those January 1, you could use the case the following January 1. Now, you technically could have till the 15th of January to submit that. You could submit it, and by the time you actually test it, it might be in like it. We're not crazy like that. That wouldn't, if you were a month short, if you were 2 months short, don't not submit the case if it's a nice case. I'm just telling you, you won't, you're not going to instantly fail. That's not the deal.
And then, so I took the ABOI, no, the AAID exam, not the oral exam, but the written exam. I think I'm an associate fellow. I don't know what the hell I am. I'm like, there's all these different things and parts, and I'm like, I kind of gave up because I was like, I don't have any of this shit documented. I quit. But now I'm like, okay, it's important. I got to try again. So is it worth finishing the AAID to skip that first exam of the ABOI? Does that save me
Yeah.
time or just
I don't, I mean, no, it's not going to save you any time for sure.
okay? That doesn't matter.
No, the only thing that the associate fellow gives you is $100 credit.
Okay. I
You
took a couple maxi courses. So I took Bart's and I took Puerto Rico. I have way more CE than I need. I just
yeah,
didn't document anything.
yeah, the documentation is tough, and I hate this being recorded, but you know, if you were missing one of those pictures, like it's if you were missing a picture, you're not gonna you're probably not gonna it's not gonna affect you. You know, you could just say, shit, I forgot to take it, but I got all my X-rays, I've got these other pictures, like and you know, for me, if I didn't take the pictures, but I if it'd been in function like 2 or 3 years and I brought them back and I took the post prosthetic photos from, you know, that are 3 or 4 years old and it looks great, like we have some leeway. Like you know, we understand that that's difficult. Like you got to remember that we're not testing you to fail, and we're not testing you to you know, to embarrass you or anything like that. Like the questions go from easy to hard, and all we're doing is trying to find out where your knowledge level is in in and I'll also explain that when we talk about the testing being run by a psychometrician, a psychometric testing organization, what it does is you got 5 stations with 2 cases within each station. So you get 10 grades. And each examiner, well, you actually got 20 grades because you got 2 examiners in each station. So you got 20 grades. If one of the examiners thought you sucked, uh, and none of the other examiners thought you sucked, or within the one case, if one examiner thought you were fine and the other one just like gave you zeros, those zeros would most likely be thrown out because it's out of the standard deviation. Uh, so uh, it becomes very bell curve, and there's the psychometric service actually proposes our pass fail line based upon the metrics that they get for the case. And I only know because I got all this information actually today, and from this year's, the examiners get graded. So if you have an examiner that you may think's an asshole, you know, like goddamn, they're hard, you know, like they just come at me and come at me and come at me. Well, it doesn't hurt you if they're like that for everyone. Like if they're tough for every candidate, they're just a tough examiner, and it won't weigh your case one way or the other, you know. But if they have a standard of being a difficulty standard, and then one person gets a super low grade, and then the other examiner also gives a lower grade in that, they look at that and say, oh, then that candidate probably wasn't very strong on that one. So there's guardrails. So if you fail a station, or you just like you get stuck and you're like, shit, I just didn't do well on that station, shake it off and move on, because it doesn't mean you failed the damn thing at all. Absolutely at all. Like there have been subjects within the medical assessment section that I would have failed had I not gone through the prep for it. You know, so just be open and just take the damn thing. Yeah.
Thank you.
Oh, of course. Um, let's reconvene in a couple weeks. Let me put together a case. Let me put together a couple cases, example cases, and we'll go through them, and I'll show you what we're, you know, like I can do this without, you know, giving anything away. Like I think I'll show you how best to fill these out, like image cropping, photo quality, X-rays that we're looking for. I'll put in a couple examples of what we don't like, good examples of what we do like, and then um, I think that you'll have a much better understanding of it. So, all right. Well, I appreciate everybody's time this afternoon, and I look forward to I look forward to everybody challenging the exam, and I also I look forward to seeing you guys back at Pathway or at any of our alumni events or anything like that. We got some cool stuff coming up, so stay tuned. We're gonna do some cool stuff.
Thanks, Moody.
Hey, you bet. Thank you guys for tuning in, and stay in touch. That's what Pathway is all about.
All right.
All right, see you guys.
See ya.
Yeah, thanks.